And I ask about the pressure, and they say, well, I like Swedish, but I don't want it really deep. Oh, no, I said, that's fine. I say, you can have both. You can have either one. You can have in between. We'll decide on the pressure together as we go along.
And I think that's a really important point. Like, why are you coming? What is your intention?
Yes.
And that you give the power to the patient to
to
decide. And please to tell me.
Yes,
when it's
exactly
not to be so brave that if it's really hurting, like you're going to go home, you're not going to really want to come back.
That's right.
It would be a good idea.
And you're going to talk negatively about massage. No, it's a good point that you're bringing up, Elizabeth, because I agree that it needs to be an open communication. Not that we're going to talk throughout the whole massage. Really, that's not what I mean. But a communication like, okay, a little less on my back, more on my legs. That was really quite painful. What was that, or what area of the body? Because I know from my experience with reflexology, there's different parts of the body that correspond to different organs or to the brain or whatever. So having a little open dialogue, very light, can sometimes give insights to the people. Like the Achilles tendon is connected with the brain, and when it's super tight, it's because there's too much stuff happening in the brain. There's too much going on, too much brain.
Too much in the mental.
Too much in the mental. And for sure, everybody agrees with me. As soon as they go, oh, that really hurts. What is that? I say, well, that's connected to your mind and your brain. You're too much in the brain. And they go, I know, there's just so much going on.
So that is really important for me, is to work with yoga breath. And when to try to get out of the mind and more into awareness of the body.
That's right.
And especially with breath work, I find it extremely effective, because then you become two people working together rather than somebody working on somebody.
That's right. And just to let our listeners know, yogic breath is basically breathing with the mouth closed through the nostrils, deep, long inhalations.
That can be that, or it can be more a fire breath, where you use short breaths very quickly, and then it helps to release knots, especially around the scapula and the neck. And it's really effective after they've done a long period of these very short breaths through the mouth, because it's difficult to do through the nose when you're lying on your tummy. And then you lock it in by holding the buttocks very tight and the tongue on the roof of the mouth, and then it holds it, and then there's a release afterwards.
And then there's a release. Oh, fascinating. So you talk your clients through the process of doing that. That's interesting. I don't remember if you did that with me.
You'll have to come back.
I have to go back. I just remember being just in a different space altogether.
Well, I think the different space comes because the first thing I like to do after doing a questionnaire to see what your intention is really aligning the energy field. And many people come because of the stresses of these days, a little bit to one side or the other. And what I find, if you look at the spinal column like a magnet, and it has two circular energy fields around it. Sometimes the field moves to the left or moves to the right or goes up a little above the head. But often people are not very grounded, like you were saying before. And to me, in order to align these energies, I often use a tuning fork, or I use Tibetan bowl, or I use music. And the reason for that is the more aligned to me that the energy field is, the more effective the treatment will be.
Okay. So you help first to align the people. I remember you were saying that my energy was very low in my body, like in the first or second chakra, and you said, let's bring it up into the heart a bit, Yeah, it was very low, not low energy, like not enough, but lower in my body.
Oh, okay. You explained, because what I do is I can often measure the chakras or the vortex energy, because that's something you learn. It's not something magical. It's a tactile sense that you learn over the years.
Yes,
and they have different patterns, like in Barbara Ann Brennan's book, The Hands of Light, that explains a lot, the different symbols and what does it mean. And sometimes just by saying that, the person can say, oh, yeah, that goes with my life, and have them find out, what's been effective for you.
That's right.
And, how do you feel when you walk in the woods compared to when you walk in the middle of the city?
That's right. That's right. I'm just going to let our listeners know that they're listening to CIDI 99.1 FM here in the townships, eastern townships. Beautiful, beautiful fall weather we're having. Actually quite warm today. We're blessed. You made me think about that when you said walking in the woods, and yes, I want to get out there soon. So, Elizabeth, tell us, were you always sensitive, or did it sensitive to these energies and stuff, or did you?
Well, that's something I actually learned.
You learned that?
Yes, I learned that with therapeutic touch, with 3 years of polarity, with some shamanic studies. But everyone is capable of learning. It's not what I like to get away that it's very magical. It's not. It's a sense that you develop just like seeing and smelling and.
I mean, they
hearing.
have instruments now in the science.
Yeah, and they
scientific
have photography and crystalline photography and things.
Exactly, they can actually photograph the aura and see the energies in the body. So it's not a mystery anymore. And like you said, this magical thing.
And what I like to do is bring it back to say the cycle. For me, we learned some different psychological thoughts about each chakra. So for me, like the first chakra is a lot about grounding, which doesn't mean anything if you don't know what I'm talking about.
Yeah. Oh, let me
like
just
survival.
Yeah, exactly. Let me just tell our listeners the chakras, or the energy centers, called wheels of light, chakra in Sanskrit from India. Wheels of light in the body that are connected to our different organs and parts and whatnot. So please continue.
Yeah, well, like with the chakras, what I like to say is that each vortex or each chakra. There are many, there's over 200 in the body, but there are 7 main ones. And what is interesting that each one of these 7 chakra are associated with a hormone gland and a nervous plexus, which means a little group of nerves. And the idea of doing polarity, Reiki, and energy work is that the more calm and aligned the chakras are, then it does affect the nervous system and the hormone system. So it's a real good preventative action for all of us.
So 2 for the price of 1?
That's right.
I love that.
No, actually 3.
3?
Well, 1 to 2. It makes 3 together. I don't know.
It's all good in the end.
Yeah, I think so.
It's all good in the end. A much calmer person, healthy.
But it's more as well, as you work with them and you explain some of the different aspects of each chakra, so the person can empower themselves, because to me, that's always important. How do you make the person more responsible for their life and their emotions? And so if you think of the chakras and you think of the first ground chakra, or the first chakra in the body in the perineum, it's, say, about grounding and choices. And so are people making good choices for self? They're often making really good choices for others, but are they making choices for self? And you can measure. Quite often, there's been, in a young child, some very emotional trauma, especially before the age of 5. And this is when sometimes this chakra tends to close. And what happens is the young child goes to other places and develops maybe more the heart, maybe more the intellect. And now it's time to come home and open the chakra, because they're an adult. They're able to make choices about their emotional well-being. And by working to open the chakra with breath and with polarity or Reiki, then they can feel the difference. It's very important for me that they feel the emotion in their body, not just talk about it intellectually. Because if you say, well, how does it feel? You've done this balancing, and then, okay, what is different from when you came in and now? And it's the same with realigning energy. What do you feel differently in your body, so that this person can go home and go back to that feeling? Because if it's just words, I don't think it does much.
Because words we can forget.
Well, and you make them, it's almost like you're making them dependent on coming